Welcome everyone. In this video session, we will discuss about surgical knots and different knot tying techniques. Surgical knots are an important component of the surgeon's skill set. It is important to practice different knot tying techniques. Two-hand and one-hand knot technique should be mastered using both the dominant and non-dominant hand so that a secure knot can be laid down during surgery under any situation, even when there is limited exposure. A surgical knot consists of a loop which maintains tissue apposition and a knot composed of several throws snugged against each other. The knots can be constructed with a single throw or double throw. A single throw is formed when one strand is wrapped around the other one time, and a double throw or surgeon's knot is created when it is wrapped twice. Hand tying technique. Knot construction can be accomplished by either an instrument or hand tie. Here we will discuss about hand tying techniques. This can be accomplished by either the one-hand or two-hand techniques. One-hand technique. First, we will talk about one-hand tying technique. The first throw is started by holding suture ends. The suture ends are grasped between the tips of the thumb and index finger, or tip-to-tip pinch. Then the first suture loop is made by passing the free suture end with the tip of the left index finger over the fixed suture end held between the tips of the right index finger and thumb. The tip of the left index finger is then passed down into the suture loop and flexed. Withdraw the free suture end up through the suture loop and advance square knot to wound surface. One hand tie technique, square knot formation of the second throw. The second throw is made by initially forming a suture loop by supinating the wrist so that the free suture end is positioned over the tip of the long and the ring finger. With continued supination of the wrist, the tips of the long and ring finger advance their free suture end under the suture end held by the other hand to form a suture loop. Flex long finger toward the free suture end and begin withdrawal of the free suture end down through the suture loop. Finally, advance the knot to wound surface. Next, we will see how to construct knots using the two-hand technique. Two-hand tie technique, square knot formation of the first throw. In order to form the first throw, hold suture ends, form the first suture loop, and the first loop is formed by the tip of the left index finger that passes its suture end over the other suture end held by the right hand. As the tip of the left index finger passes its suture end over the suture end held by the right hand, the left thumb passes under the suture end held by the right hand. The tip of the left thumb advances up through the suture loop, replacing the tip of the left index finger. The free suture end is then held by the right hand is passed over the suture loop. Pass free suture end down through the suture loop to form single wrap throw. Advance first wrap throw to wound surface. Two-hand tie technique, square knot formation of the second throw. In order to form the second throw, begin formation of the second suture loop. The dorsum of the tip of the left thumb is passed under its suture end in order to direct it beneath the other suture end that is held by the right hand. The left thumb advances its suture end beneath the other suture end to form a suture loop. Pass index finger down through the suture loop. The free suture end held by the right hand is passed under the suture loop to be positioned between the tips of the left index finger and thumb. The free suture end grasped between the tips of the left thumb and index finger is advanced upward through the suture loop to form the second single wrap throw. To construct a flat square knot, forehanded and backward throws are alternated, and the suture strands are pulled with equal tension in opposite direction, but in the same plane. Sliding knots, also termed slip knots, are created when unequal tension is applied to the strands, such as during one-hand knot tying. Surgeons who do not reverse the position of either hands after forming each throw will construct slip knots. Furthermore, the application of greater tension to one ear than the other encourages construction of the slip knots. a practice commonly encountered in tying deep-seated ligatures. Sliding knots are useful in situations when flat square knotting is difficult or cumbersome, such as in limited space afforded by the deep pelvis or vagina. In general, sliding knots have a higher failure rate than that of flat knots. In summary, we discussed about surgical knots, which is an important surgical skill, and different knot tying techniques, which includes one hand tie technique and two hand tie technique. And we also discussed about flat or sliding knot configuration. Thank you.